Okay, I have 6:30, so let's start the monthly meeting of the Surrey County Health and Human Services Board meeting. On the call to order. Roll call
Dale Schluter,
here.
Marshall Savitsky,
Here.
Michael Maestri,
Yeah.
Chris Rusk,
Here.
Randy J, Don Pettit,
Here,
Carol Pearson, and I believe Sabrina is trying to log in.
In addition, since Jesse is not here, Mr. Schuman has taken his place and he will act in his place on any action items or more discussion. The other thing I'd like to point out is Paul is going to be leaving us. Retiring or he's going to retire, retiring, moving to greener pastures.
Can work less hours.
That's not.
Mm.
He will be missed. And pleasure working with you.
Yeah.
These years. For your service.
Thank you.
Okay. It's going to be the Pledge of Allegiance.
flag, the United States of America, the republic for which it stands,
Under God, indivisible,
Neville,
injustice.
Murphy.
We're all.
Certification.
This meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
Do we have any changes to the meeting? None, we'll move on to public comments. Are any members of the public here who wish to speak?
I don't see any hands up.
Okay,
Nothing online.
all right. Comments, consider approval of minutes from last month's board meeting.
Move to approve.
Second,
Do we have a motion and a second? Everybody in favor, say aye.
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 Passed. Moving on to committee reports. Elaine, and, LCO.
Okay, my short and sweet, but me report. This goes back just a little bit, but it kind of is current too. We have not had any positive cases of COVID or influenza in the last 2 weeks. We started the MAT program, the new MAT program, and it's been relocated to the main clinic. And we also have Angie Pink as MP, a psych, Amanda Swino, Malcolm, APNP, Jessica Hartman, APNP, and Dr. Steve. We're also in the process of creating a harm reduction program for LCO Community Health Clinic. This will be led by Christian Clarkwist, RN, Brittany Longtime, RN, our directors of nursing with assistance of Teresa Moore, CMA, who will be the liaison for harm reduction and facilitate substance use disorder patients for the MAT program at the Tajiki building. The MAT program has worked hard to help control SUD, but with these changes, we hope to create a gold standard MAT harm reduction program for our tribe, allowing us to hopefully win this war on opiates. Okay, this was given to me by Dr. Steve. And it was an update, so we know where things are at now with some of the community. We I had the chance to talk to our elder director, and they are working on a tribal caregiver conference that'll be conducted in September 19th and 20th for our whole community. And former Governor Martin Schreiber, am I saying it right? Will be there during that conference, and he'll be presenting too, so he'll be joining us. They're working on their food program and waiting for their funding to come through now, and for the food security for the Badger Care, the elder socks boxes, and the elder food boxes. So they're waiting on Title VI and Title III. Our apartment building that we have coming up for the workforce is really moving along. We will have 40 apartments within that construction site. And then we're also we're still pursuing our supportive housing project. So we're still working on that. That'll help also those who need that care. And those who we're trying to build on our housing facilities that we have for the homeless, the men's shelter, the women family shelter, and Norwood Haven. We're trying to fill those as quickly as we can to help those who are homeless and need that support. We're still sending our people to treatment. We're trying to look for those long-term aftercare programming. Still moving forward the battle that we're facing. And I think, is there anything else?
No, that was.
The school's got the school powwows coming up. First time we have a school powwow since the COVID hit. So the school powwow will be in May. And it'll be at all the buildings. Well, actually, the high school, middle school will be in the morning, and intermediate primary will be in the afternoon. So we're gonna have a full day. That's in May. I don't know off the top of my head. 18th. So I just want to share that to invite the community. It's good to be able to be together again. So
Do you have an anticipated move-in time for that 40 apartment unit?
this fall, right?
Yep.
This fall. Yeah, it's really coming along.
That's not just gonna be like a dormitory, is it, for students at the university?
No, that's a separate project for the university.
That's a separate. project.
Yeah, that's gonna be housing for the students.
Workforce.
And this is the
40
workforce.
apartments, 2 levels.
Good.
Yeah.
Yeah, sure.
Lorraine, do you have any estimate of how many folks or families are homeless at this point?
We don't have that total figure because some are bouncing,
Yeah,
some we try to help through the winter. They wouldn't freeze to death. We put them in hotels, and we're trying to help those who have nowhere to go. Because part of it too is some were evicted, so that caused them to be homeless, and then it affect the whole family. It's a mess. So we're trying to do things we can. We got a pardon and forgiveness committee at this time. So those who are trying to turn their lives around, are turning their lives around and working on recovery will have that ability to hopefully get back into housing again. Those are some of the things we're trying to do. So
that's a good thing.
Lorraine, I apologize when I recognized you at the beginning. I called you Elaine. I'm sorry.
oh, you're not the first one.
So, that's my excuse. to say.
Yeah.
Okay, any questions? Any comments for Lorraine? All right. Admin,
Senior resource.
again, it's the sun in my eyes.
Okay, all right. It's that time of year to do the annual bus report. So I've got a couple different things to give you tonight. First thing I'm gonna pass around is going to be just our bus recap for 2022. So you can kind of see how many rides we do with that bus and also what kind of rides they are. And the next thing I'm gonna pass out is going to be our actual annual report that was submitted to the DOT at the end of March. You're welcome. I'll start with the recap first. As you can see, there's an awful lot of rides that we do every year. All right. This year we did 2,667 rides. And those are split up into two different categories. There's the medical, employment, nutrition, social activities, shopping, and others. And the others can be anywhere. We've got some ladies that just like to be dropped downtown and, spend the day for a couple hours and then go back home. But the majority of our rides are either medical or shopping. That's what our largest number, our largest population is. You can see there's only one rider difference between the medical and the shopping. Okay. The largest population, of course, that we serve is the elderly. And then we have elderly with wheelchair. And then we have disabled, non-elderly, disabled, non-elderly with wheelchair. So those are lower numbers. And typically those that are non-elderly are ones that we transport from the nursing homes and hospital and stuff like that to take them home. Or some of them, we have one individual right now that's a non-elderly that lives in one of the local hotels that we take him to all his physical therapy appointments 3 times a week. So that's kind of where our numbers are. And last year, the bus drove 13,926 miles and the bus was working 2,667 hours. And that's, Monday through Friday that bus runs. So there's an awful lot of, time in there that they do and a lot of things that they do. So the next thing is our specialized bus transportation, our annual report that we send to the DOT that Carol Kuklinski and I work on in the Department of Health and Human Services. She's kind of my go-to person. The DOT sends her stuff and me stuff, and she goes, anything that I send, whether it be our quarterly reports or our annual report, she goes over them. If there's anything that she sees, well, we need to tweak this or do that, that Carol and I, do that. And then it goes on to Lori Jacobson at the DOT. So you can see our annual expenditures, drivers, mechanics and stuff like that. That's the first category, along with the, salaries for the staff would be like the secretaries that coordinate all the rides, schedules all the rides for the bus, and then any maintenance and repairs. This year, our maintenance and repairs were really low, thankfully, because we had that new bus that the county so graciously bought for us last year. Office supplies, things like that. The fuel and lubricants, we do get our fuel at a discounted rate because we get our fuel through the Sawyer County Highway Department that they bill us every month for. Our insurance is in there. Communication equipment, that's the phone, the bus phone, that's included in there. Then there's our bus license, and our supportive services includes everything from the part of the bookkeeper's wages to paper, phone bills, things like that. We have discovered when we did the annual report this year and looking at the numbers and costs going up, we will be in 2023 increasing that supportive services because we're not capturing enough in that category for the bus because those services, have gone up. And with now not having Rose as our CPA, without doing that for us for nothing, gratis, we now have a bookkeeper that we have to pay that comes in 2 days a week, which averages anywhere from 12 to 20 hours, every 2 weeks. So that will be included in there this time. Passenger revenue, as you can see, it's not a big amount, but the participants, the people that ride the bus, the riders, it's 50 cents one way. So if they go 2 ways, it's, $1. Then there's you can see the allotment that we get from the DOT, the county levy. So that all comes up to 0. And then the next page that you have is the trust fund. And that trust fund, every year, if there's anything left over in the bus account, that has to go into a trust fund. And that trust fund is held at Edward E. Jones and has been for the last 4 years. So any expenditures that we don't incur during 20 previous years, whether it be 2021, 2022, or whatever, that money goes into the Edward E. Jones account. This year, $11,885.78 will go into the Edward E. Jones. As you can see, number 4, we had an adjustment of $13,881. That's because we lost that in the market in our Edward E. Jones account. So that's where that goes. So the closing balance will be in the Edward E. Jones will be the $32,962.64. So We do have some things that we want to do with the bus, but anytime we want to spend any money on the bus, we have to get approval from the DOT before we can do that, because they have a list of things that we can and cannot do that we can use that trust fund money for, or the money that we have. Because I know when we were talking about doing the bus last year, we were going to use that money as a down payment for the bus, and I had to go through a lot of red tape and find out if the DOT would let us do that. Well, in the meantime, the county, bought us the bus through their ARPA fund. So that's why there's so much left in that account. So, and going to be doing some adjustments with the budget for next year. Some of you may or may not know, but I know that Lynn and Dale know that the state has been behind in getting us our money, our annual money for GWAR. Typically, we get that money the 1st of October. We still do not even have our contract yet. We do not even know what the contract should be. The last email that I got last week was that they were hoping this week that they would have some idea what those amounts would be, and we could start looking at it. But the downside of all of that, even if they do get the contracts, we won't see any money until June or July. So we're right now, so to speak, we're living off the county money, our county allotment, and then whatever we get, in revenue from, or contributions, donations from our participants in our meal program. So it could be, so we're working on a very tight budget right now. Any questions on the annual report?
They expect us to go 6 months without.
Well, in fact, today in the mail, I got the check for November and December from GWAR. So right now, sitting on a table next to my desk is 2 piles. So when they give me the word that I can file the claims for January and February, I'll, do that. And I'm, putting March together now that we're done with March. So, but they said all of our claims will go in, but they won't see any money from the state till June or July. So then that means we won't see any money until July or August. So then it'll be almost time for the new contract year.
We
Yep.
The local match required,
Yep.
is that any that aren't budget every year?
Yep.
Mhm. Yeah. Yeah. Mhm. Mhm.
Any questions from Joey? Do we need to take any action on any of this?
No, because I know Lynn had asked previously at our last board meeting about if we need to do a resolution. The resolution doesn't come due until October, November. So we're actually, right now, it's just that, the annual report. So what we're doing and what we've done for this last year. So we're good. All right.
And the next one is a vote on there.
Sean is on.
No, I can talk about it. I don't have any of these reports in front of me, but I do know. In the adult long-term care unit, we talked about having that shared position with Iron County. We have here the person, he is a person that's employee of Iron County, so he'll go through them. But so they're working out the details now, but so he'll be working about 20 hours a week for Iron County, then 20 hours a week in Story County. So it's been a long process, but we finally have that person. That's for the informational assistance specialist position that was open for a long time. If you remember, we Iron County and Story County had 2 part-time positions. We had a difficult time filling those positions, and this is a way to hopefully get somebody who will stay for a while.
Behavioral health.
Alicia submitted her usual report. If you have any questions, I believe she's online.
Alicia, do you want to speak?
I added a new report, a couple new reports in there. They're actually Joe's. But I figured seeing as he's within the behavioral health programs, I would add it to mine. So those will be following, right, that one. And then there's a report on transitions, which Joe can speak more to both the crisis context and the transitions census. As far as behavioral health, we have an increase in CCS referrals. We just had a meeting today and we have 5 new referrals, but we do not have providers, mental health providers to meet the needs of those people. We're doing the best we can with what we've got. We may have to create a waiting list because there are some consumers that don't want to be served by telehealth. So they want in person. But I'm working with the 2 contracted providers right now, hoping that they will pick up some extra clients. It's just that they have specific areas they choose to serve, such as people over the age of 18 or only kids under 18 or people under 18. It just depends what their preference is. CST, we had our quarterly meeting, which was well attended on April 5th. I think that was probably the highest attendance we've had in over a year. We have a couple new referrals. This report was written on the 29th, so a few referrals have come in since the 29th when I submitted this to Paul. CLTS, those numbers just keep growing. The state has unwinding drop-in discussions every week, sometimes 2 times a week, Tuesdays and Thursdays, sometimes just Thursdays. So we've been attending those because there's certain things that are changing within CLTS due to the end of the pandemic. One really important change is, along with the functional screen that we have not had to do during the last 3 years, every consumer will now have to have an updated functional screen along with a comprehensive assessment. And as usual with the state, they don't give you any type of assessment, any type of like a template for the assessment. They just tell you you have to do one. So we are working with different counties to find out what they're using, what they're putting in their assessment. I mean, we can use, I thought we would be able to use something like we use in our behavioral health assessment to cover certain areas, but there are different areas in CLTS that need to be covered compared to behavioral health. So that's a work in progress, but myself, Ruth Ann Gilmore, and Terry Brown, we are working on that together to get that ready. So when we start doing the functional screens at the end of May, we will have that assessment ready to go to complement the functional screen. That's about it.
Okay, do we
Yeah.
have a question?
Alicia, tweet here.
Hi,
What happens
Tweed.
to those 5 referrals that are sent to CCS that you cannot accept because no staff? What happens to them?
So when we get a referral, the person doesn't automatically get on CCS. We have to collect information from previous therapists if they had therapists. If they didn't, they have to have a mental health or a AODA assessment done. We have to complete a functional screen in order to determine eligibility. Not everybody that wants to go on CCS is determined functionally eligible. So in the meantime, what I'm doing is reaching out. Like I said, we have 2 contracted providers to see if they are willing to expand what they normally would see in a person for behavioral health. Joe also helps out with that. He may be taking on 1 person because 1 person may be discharging from CCS. So we do the best that we can do. If CCS is not something that we can provide them, and a lot of it is based off the mental health provider. That's the biggest glitch with CCS. Any mental health provider has to be CCS certified. It's not that way with the substance abuse provider. And like I said, I don't know who creates these rules, but it poses a lot of barriers for not only the consumers, but our agency, because we're so limited in our staff. We do have 1 potential candidate, and I have been discussing with our administrator, Andy. Hopefully something will come out of that. I'm hoping. So in the meantime, it takes time. We have 1 service facilitator, That's Haley Sands. So she does the initial intake on all of them, the functional screen. And then once that functional screen is done, we have 30 days to get the rest of the forms that we have to have, AAA, AA's, all that sent in. I don't know if that answers your question, probably not, but that's the best we can do at this time. We try to work with the contracted providers. If we can't, then they may go to North Lakes for just outpatient counseling.
So you or somebody else meets with these 5 referrals and decides their eligibility? And then-
We facilitate the functional screen. So you enter information into a functional screen that the state's provided. The screen calculates the information and the screen determines whether the person is eligible. Myself or Haley does not make that determination. We enter the information.
So if they're not eligible, then you find somewhere that they can get help?
Yes, we will refer them to outpatient counseling. Yes.
Well, Alicia, I just wanted to verify this with you. It's safe to say that functional screen is a standardized assessment,
Yes, it is.
or you can't subjectively try to take somebody in. They have to go through that assessment. Thank you.
Yes, they have to go through the assessment.
Any more questions for? What's next here?
Yeah, just in your pack.
I've got the crisis report there. Can I speak to it? I used to present this information every board meeting from the month prior about the crisis in Sawyer County. And for some reason, we wanted to get these meetings, or a member decided they wanted these meetings faster, so they took this out of there. I decided I wanted to share it because it's the biggest issue in this county. The sheriff is speaking as to mental health and AODA, all these issues. And I sit around and I listen to things that are just as important or not even as important as this data. So please bear with me and listen to this information. For the first 3 months of this year, I've had 60 hours of crisis contacts. Of those 60 hours, that was representative of 47 individuals. 33 adults, 14 minors. 14 males, 33 females. Of those individuals, 9 of the children, CD represents minors, children, 9 children were deferred to safety placements. 5 children were hospitalized. The adult deferral, 12 adults were hospitalized, and 16 were deferred. We had 25 mobile crises in the first 3 months of this year. That means one of Carolyn's people came out and assessed the situation. 16 were placed on 72-hour holds, 4 were AODA, 43 were mental health, 9 were representative of dual disorders. Again, 20 total had certain safety plans. We had some that didn't need services, 3 were CSP, and the other one were just crisis. So what I want to point to is that all of last year, I had 107 contacts. We got 3 months into this year, we're 47. We're poised to have some significant mental health and AODA follow-up crisis placements and lack of, as Alicia spoke to, providers. When people do not have providers, they crisis again. In 2022, I said there were 107 total contacts. 63% of them were referred to Northland for a mobile. I handled 36 of them without waking up Carol's people in the middle of the night. You know, a majority of those 32 were duplicate people that they had another issue again later on. I don't look at racial statistics. You know, some people always are saying we should look at the race, but for this or that, I just look at them all the whole. But when something jumps out at me, there is an inordinate amount of Native American minor females. If you're gonna look at programming out there to target suicidal minor females in this county and predominantly Native American minor females. I don't know if it's related to anything, but it's something you might wanna talk about for prevention. I think that it's representative of the complexities in society, all this social media, the earlier onset in relationships and these struggles, emotional struggles. And we have everybody that I'm dealing with here, the majority of them are all suicidal. They want to kill themselves. They're texting somebody, leaving a note, having an attempt, whatever have you. So that's that with the crisis. I just think it's important to look at it. You know, last time I was here, I was asking Andy, seeing if I could carry over some vacation time. Andy was good enough to help me work that out so I can get it out of the books. But this is why you can't use it, because when you got 60 hours above and beyond in 3 months, you know, it's just, it adds up, you know. But thanks to Andy, I'm gonna work that out. Getting back to transitions. The next one there, you can see that report. I just bring to your attention the number of people at the beginning of the month, at the end of the month. In January, we started with 3 residents, we ended with 5. February, we had 5 and ended with 5. In March, we had 5 and ended with 8. If you do the math, the way I look at it, each one of those beds are saving us on the low end about $300, $500 a day. If it's not a Winnebago placement at $1,500 a day, you can't get anybody placed anywhere anymore at less than $200 a day. And the Trempolo placements are well over 300, almost 400, I believe, a day. And the issue with Trempolo is the state had set that up so when people are placed there, their Medicaid cards don't count. So I got another request today. Is the county willing to pay for the provider, the doctor, the person we have placed in Trempolo under a commitment? The doctor says this individual has a nodule that needs to be looked at. So they're requesting us to pay for the CT scan, which I think it's like anywhere from $3,500 to $5,000. So in essence, the county becomes a managed care organization providing healthcare out of taxpayer dollars. It's unfortunate. That's a great issue to bring up to Wisconsin Counties Association. That's cool. Okay. So, you know, now if that person was able to be out of there, they could have their Medicaid card and that would cover it. But because they need that level of care, county's paying the medical. But I'm really concerned about these crisis contacts jumping up like this. I don't know what to attribute it.
We do, can I jump in, Joe?
Go right ahead.
We do have a facility that's being built at this time for juvenile minors.
Okay.
And located, it was all the tribes distributed. So it's gonna be located over by Minocqua area. What's the name of that territory? Not too far from Minocqua.
I like the Flamos.
Yeah, over that way, a little bit farther than that, in a location away from everything where our young people can go and get help that they need. So that's in the works still,
Okay.
and that's gonna house, God, I can't remember how many. Yeah.
The minors.
Yeah, they're
Juvenile.
so all the younger people will have a place to go and need that care. We're in the process of that being constructed now. And I don't know the opening date, but that's coming. Okay, that's something that's important. And then when it comes to that funding source, you see all those initiatives that are happening now from the state and the national level for mental health. There's got to be ways that we can get more support in that area for our people, because we see that nationwide what's happening. And coming out of the pandemic, we really see that rise in need. And all that, the opioid epidemic, all the drug epidemic we're seeing, all that's happening, the ripple effect, we've got to provide those services. So whenever we have a chance to speak, all the representatives at those levels, we're trying to go after what we can now, because you're right, Joe. Yeah, it's only going up, and thank God we have transition house to help offset that.
Well, I figure out if you stay at about 5 a month conservatively, it's about 600,000 a year to stay, at least.
At least,
Without any,
at least.
so, you know, it's,
So, thank God we have that program to operate.
I was contacted by the tribe today on somebody that they might want to refer, after they stabilize the transitions. So we work cooperatively, with the tribe on these things, but I appreciate any support you can get. And perhaps out at the tribe too, you can talk to, Gary and see where they're at with, they used to have a crisis, like a warm line, they called it, a crisis line for like, where somebody at the tribe could call somebody if they needed to talk. I don't know, they had it for a while, and then it shut down. One of the LCO officers made me aware that it wasn't running any longer. I don't know if that's a possibility, but sometimes people would like to talk to a tribal member rather than just talk to somebody outside of the tribe. And we could get that in the mix again, so thank you.
Thank you. Next year. Carol?
I have a question for Joe, if you don't mind. When you said that individual at Trompelow, had to have some kind of surgery, couldn't the doctor refer them to a medical establishment, have the surgery done and then return them? So that the Medicare would pick up the,
I mean, kind of like discharge them
and,
from the facility,
right,
do that, and
and then bring them back over?
that, no, I could ask Sean about that, but they don't usually do those kinds of things. I tried that once when we sent somebody to Winnebago, the police officer broke his femur with a baton and needed surgery on that, and they got him out of Winnebago to get the surgery, so it would be paid for. And it didn't get, we didn't pay for it, but it kind of blew up in my face.
Oh,
You're
yeah,
not supposed to do that.
oh, that's not proper.
Level of care,
Yeah.
and if they really need that level of care, we can't just let them out and say they don't need it. and
Because,
bring them back in.
When they're in those facilities, it's because they're under commitment being dangerous to themselves.
Exactly, but I'm thinking Sacred Heart, for example, has the unit. So if you got them in the Sacred Heart, they did the surgery and just pushed them upstairs and then discharged them back to Trumbull. I mean, that was my thinking.
Yeah.
Because they would have a safe environment there.
Right, they wouldn't, Sacred Heart wouldn't do that.
You wouldn't do it, okay, just thought,
Sorry, is a problem.
think the doctors have a little discretion to be able to do
They
that.
haven't played the case of
It's
it.
the-
No, we haven't done that.
Okay, I'm sorry.
Good idea.
Okay, now the Child Protective Services.
Want to comment on it all?
Want to comment on the,
Yeah, I'll comment on that before you make your comment.
okay.
We have the substitute care report. Cost for your review. I also want to let you know, we don't have another CPS report. For two reasons. One, we don't have somebody to do it. And the other one, looking at the CAN report from EWSAC, the numbers are very inaccurate. I work with Kathy Garvey, the administrative assistant for that unit. And we did some bean counting and I go, this is not accurate. So I don't know if we're putting garbage into the EWSAC system and it comes out with that information. So when that unit settles and you get a supervisor, I think probably you want to take a look at how can you get more accurate information to give you a worthwhile report. Because that one, I looked at the last few, it is not accurate.
Yeah, just an update on the unit itself. We are still advertising for a children youth family supervisor that would oversee CPS. We do still have a contracted interim person as supervisor. We have 3 positions that are advertised or were advertised, still have 2 open. We did hire for one, that person will start not next week, but the week after. And then outside of that, we're employing a number of LTE employees from neighboring counties or further away to cover weekends and evenings that are doing case management and some of the IA work for us. And some of the other counties are picking up some of the access phone calls as well during certain days of the week. So we've got a piece together, but we are still out there looking for permanent hires to rebuild the unit.
Youth Justice.
You have the youth justice report submitted by the lead worker, Sarah Anchowskis. Couple of comments about this is Sarah has developed a different culture with more accountability for the juveniles that's been there previously. And as a result, she's becoming overwhelmed and thankfully, Mr. Alvarado agreed to have one of those open positions become a YJ worker. So it's actually being advertised for that. And she also was getting one of the LTEs helping her out, I think, yeah. And also, we've arranged for the supervisor down in Eau Claire County to provide her supervision, and she's fantastic. Those two are clicking really well, so she's getting fantastic guidance. That's it for that.
Okay.
Economic support, you have your monthly report for your review. And public health.
Okay, I put in the public health annual report for everybody to view. So I hope if you have any questions or comments on that. Page one. We won't go through it. That's just annual report that we posted on our webpage. The other update is we do have our 140 review on Tuesday from 9 to 12. So Board of Health members, anybody wants to join us. And then the only other update I have is that we're working with Nicole Lipinski real closely for emergency management, just making sure we're prepared should there be any flooding. So we're figuring out staging. Hayward Health Services is one that we're most concerned about if we have to transfer residents out of there, what that looks like. So we've been working closely with them in the hospital and options. So at this point, we Nicole has had a drone out there. Everything's looking good right now. Reports on the ground sound like things are melting in slowly enough. So we're just crossing our fingers we get through this week. So from the highway, it sounds like there could be potentially some water over some of the roads, but we're not overly concerned about that at this point. So just kind of keep an eye out. That is that piece. The other piece we have, oh, go ahead. Did you have a question?
Speaking of flooding, somebody was telling me about the culvert on Interstate 63.
Yeah.
It goes into the lake. Is that open now or?
Ooh, I don't know.
They started,
Oh, okay.
they started removing the pavement from the dealership there when I saw it last yesterday.
Okay, sure.
They hope to make that much larger, so you can accept all that water from Smith Creek.
Mhm.
And then Smith Creek backing up affects the hospital.
Yeah. Yeah. Nursing home especially.
Yeah.
Funding on both sides.
Mhm. So
Okay.
hopefully we won't have those issues in the near future, but I want to keep an eye on them right now.
Okay.
Okay. Any other questions for me? Otherwise, Matt is going to present on tourist rooming houses and give you a little bit of information on what we have been seeing over the last 2 years and what we're dealing with right now.
Thank you. Yeah, I just want to kind of give you a little synopsis of where we are with tourist rooming houses and kind of a little bit of the history over the last 5 years and where we're at now.
And just for those tourist rooming houses are Airbnb, VRBO, because we do have some new people on the committee that may not know that, so.
Yeah, all one of the same short-term housing, rental properties, Airbnb, you name it. They all fall under the same category. And if you would, yeah, thank you. So we became an agent of the state, meaning that we license these types of facilities, lodging facilities, campgrounds, restaurants, that kind of thing. And since we've taken this over back in 2018, we started out with 275 licensed facilities, which was then, handed over from the state. And since then, that first year, we did a thorough investigation of what was out there and that needed to get licensed. And that you can see that first jump right away in the graph, and that bumped us up to close to 400 licensed facilities. Since then, to date, we are in the number that's presented there for 2023 is currently, as of today, 557 licensed facilities and climbing daily. So this is the new trend. This is what people are doing. This is not necessarily retirement people anymore. It's younger folks that are purchasing these lake homes, or it doesn't even have to be lake homes, but they are looking long term, so they're renting them out for the time being until they're able to use them. when they do actually retire. In the lower part of this slide here, it just shows you where some of these are located within the different townships. And then next slide is kind of geographically showing where a lot of these properties are. Of course, you can find them most heavily populated around the major lakes. But we're also seeing trends now where even whether you're along a trail such as the Berkey Trail, ATV, snowmobile trails, and then also in the urban areas such as in town Hayward, in town Winter, wherever. It's just we're seeing them come up, and people are making opportunities for themselves, and it's just growing leaps and bounds. And so part of the reason of being here is trying to get ahead of this. And so we've seen some trends in the last few years, getting some complaints about certain things, and with it not slowing down, I thought after the pandemic, those 2 years during the pandemic, things really took off. A lot of real estate transactions happening. People that wanted to get out, got out, and the other people that wanted to buy were buying. So there was both ways. I thought now with interest rates going up, things would slow down. Not seeing that as yet this year. So yeah, at some point you think it would plateau and we would settle down a little bit, but we're not seeing that yet. And so some of the concerns, these are concerns that were brought up 5 years ago when tourist rooming houses were brought forward under the zoning program and department. And then some of these are some of the ones that we're seeing currently too. So I won't read them all there, but you can see them, such as noise and parking issues, additional lodging that goes with these facilities. So people bringing RVs and tents and campers and everything else, to garbage and people placing dumpsters on shared roads, and then garbage trucks tearing up those roads, and then people getting upset. And so we hear those kinds of things. But the one that we're kind of looking at this evening is the last one, occupancy. And so we've been seeing, when I go out, and Andy, if you want to move to the next slide, we're seeing where people are really pushing the envelope as to how many people can stay in these facilities. And so the one on the left here is just one room of 2 rooms that are basically a bunk style, where there is actually, I think there was 7, 8 beds in this one room. You can't see them all because some are behind me taking the photograph, and there's 2 rooms like this. So they're advertising for 20 plus people, 25, 27, I can't remember, but. And so another space on the right there where you only have a loft that's only 3 feet high, and they're shoving mattresses in there, and that's an elevated loft, not ideal. And this was not, that one's not allowed. That one was not licensed as that, but we're seeing people wanting to get away with those kind of situations. Next slide, Andy, please. Because just the next few slides are just some of the examples of what we're seeing. People creating customized bunk beds in their, say, lower level of a walkout basement, where they're trying to get 8 additional people crammed into this facility. So again, it's just some people are I wouldn't say this is happening in all facilities, but it's happening in a lot of them. And some people are fine with just having what would say an average number of people. So what that home was originally designed for. They don't want a ton of people, but then there's the other extremes where this is a pure business for them. They don't necessarily really care as much about what's going on. It's all about dollars. So yeah, it's we're seeing a lot of these rooms that are being put with many beds, many sleeping arrangements. And so we again want to try to tackle this a little bit more, so we're not seeing as many issues. And then you can, yeah, so then right now what we do for determining occupancy is what the state has done when they transition and hand this over to us. This is what they were doing. They're measuring the cubic footage of a room. So you get an average room that's maybe a 10 by 12, that's 960 cubic feet. So they say an average adult needs 400 cubic feet and an average child under the age of 12 needs 200 cubic feet. So we're taking that cubic footage and dividing it by either 400 or 200, and that will determine how many people can stay in that room. Okay, that's all fine and dandy, but then when you measure room and tell them that you can only have you can have 4 children in here, but only 2 adults. Oh yeah, that's all for children. Or you see some of those bigger rooms, yeah, all the children will stay in there. Okay, we know that's not necessarily happening, but how do I enforce that? How do I know what's actually happening there? We know it's not all children that are being put in those rooms. So it's hard to enforce this particular rule and address the occupancy issues that we're seeing. So the next slide will next 2 slides is some work that we did with the zoning department. They came up with this to use existing codes from DSPS that helps us calculate daily gallons per day of septic, wastewater. And so there is a residential formula, and then there's also a tourist rooming house formula. And so with this, we see in the green in the kind of the middle column, basically what it comes down to is with this formula, we're looking at using this to assign occupancy basically. And what it basically says is that every bedroom then would be allowed to have basically three people, whereas a traditional residential room is designed to have 2 people. The reason why you would allow 3 people is because they calculate that when you go on vacation, you're not necessarily showering every single day. Whereas if you were going to work every day, you may be taking a shower, whatever. There's less water being used at these rentals during that time. But this helps us give us a platform to use and a formula where we can assign those when we go out to a new facility. Instead of doing the cubic footage thing, we can, based on and not just, we would have zoning do some other additional homework prior to this and saying, okay, based on what we know about that facility, this is what we're going to allow them to do. So then the next slide as well, this one, the first one was for traditional septic systems, and this next page is more for holding tanks. Again, it's another formula based off of existing codes from DSPS, residential versus tourist rooming houses. Whereas on the right side, in the kind of the light blue color, it has been adapted a little bit to address, especially the last column where it says 7 days. The code by DSPS, their formula uses 5 days. Well, a typical rental week is 7 days. So we adapted this to accommodate the 7 days. So there may need to be some looking into to see if DSPS would allow us to use that formula. But you get an idea of what we're trying to do here is we're trying to basically assign a facility what their occupancy can be. And if we want, we can always go back to these and talk more about them if you'd like more information about that. Zoning is the best ones that can describe that information, but I'll do my best if anybody has additional questions on that. So next steps is that, first step there is for ourselves to present as I am here to the committee, and also in 2 weeks when we have the zoning committee to share this information. But tonight we're asking the health board here to look into this a little bit more and see if we can maybe create an ad hoc committee. And also if the zoning committee is open to the idea as well, that we form a team to look at this situation. We've provided kind of what our thoughts are, one of the better ways to go about it, but not everybody's going to like that idea. So knowing from experience a few years ago, we want to create this ad hoc team to then work through this to say, yes, this is what we want to do, or maybe we come up with something even better besides out of this. But so I guess with that, then if going forward, if that's what is deemed needed to do, then at some point, then the ad hoc committee would then go to bring that, whatever the plan they develop to the board and hope for approval there, so.
So one of the things, oh, go ahead.
If you have a facility like you showed, that there's numerous peoples in a room, what is the county's liability, because we're granting licensure? And I'm thinking, you know, hazards, fires, things like that.
Mhm.
Are we responsible, the county, I'm speaking of, not me, because we're the licensures of those places for safety?
So, I mean, there's many other codes that we're following as far as making sure they have proper egress and that kind of stuff. Smoke detectors, carbon monoxide detectors, so, yeah, like you saw. A lot of those pictures are those bedrooms or bunk beds in a lower unit, lower level of the facility. But as long as they have at least 2 means of egress. So we do look at that information as well. So,
Kind of an inspection before you grant you the license to make sure that everything's in place.
yeah, so we go out and we look at the home before we issue that. So making sure that there are no safety or health issues, concerns that if there are, they need to be addressed before we can issue that license.
How did you jump from 200 to 500 and something? Did people self-report or did you go out finding these places?
Both.
I know they're out there.
Yeah,
We
both.
probably don't have them all yet.
No, but we are doing a really good job. I would say we're probably about 95, give or take a few percentages, successful at capturing all the facilities out there that are advertising. We use a platform company called Granicus or Host Compliance, and they basically help us search those major platforms such as Airbnb and VRBO and all the other ones. And they report, we have a dashboard so we can log in at any time and look and say, they run the formula a couple times a week. We can go into that dashboard and see which ones have been added. We look at it about once a month where we pull the information, and then anybody that we don't have in our database, we're sending letters to, and then we get them and get them licensed.
Julie, does the license fees support all the staff you're gonna put on this and all the time he's put into this?
Yeah, no, we'll need to be looking at that when we're doing budgeting this year for how much expense is going into this. The other thing with this and why we're looking at occupancy is the more people you get in the place, that means more cars, more noise, more whatever. So we're hoping that occupancy would actually be able to help us control these issues in this way. So that's why we're looking at the occupancy. And the other important thing about that is we can't enforce this type of occupancy code without an ordinance. So it's going to take all of those things. Right now, we tell them what the amount of people that they can have based on what Matt had showed you originally with that little box, but this would limit it more.
Just to follow up on your liability question too. We are doing inspections before they're licensed, but there's over 550-ish now of those. How often do you go revisit a property once it's licensed?
Yeah, our goal is to visit them annually. But because there are so many, sometimes it takes 14, 16 months. And then we have the issue with so many places being seasonal here that, and then being booked during summer, it's sometimes hard to get into those on an annual basis, but 2 years is usually max. If we aren't in there in 2 years, they're getting a letter from us and we're making sure we get there.
And we can't control what they're doing really between visits.
Yeah, we're there once a year, so we do get neighbors that will fill us in what's going on, so but yeah,
I think that's why we're talking about this, is that I think everybody recognizes the big economic benefit these have had on the community. But at the same time, we're starting to hear the kind of the dull roar. If you go to a town board or a town association meeting, I heard some very distinct comments about unhappiness, because that's where the first complaints are usually going, is to the town board before they get to us. Our new code enforcement position that we started last year, we primarily had that person working with the dog pound and animal control, but he was sent out now on a couple tourist rooming house issues over the winter with trailers, snowmobile trailers, blocking accesses and things like that. So we're starting to see more. I think the idea of this discussion is to get out ahead of it before it becomes any more of a problem, so that we don't let things dissolve into even bigger issues. So the concern, I think, like my concern, I'm sure Matt's and Julie's concern, is we don't want to invest a lot of staff time. I mean, the staff is hearing the complaints, we're hearing the public comments. They see some of the red flags, so to speak. We don't want to spend a lot of time in this to have the board say, not interested, don't want to touch it. So that's why we're kind of bringing this up through this committee, which is the public health, the local agent status that does the licensing, and then the zoning committee, which sees some of these from like, there's the issue of multiple properties per parcel and what's a resort definition that they're coming up with there. To see if the committees want to support an ad hoc committee, take that to the board to get the board to approve the ad hoc committee up front. And then we would create an ad hoc committee, intention of having it with stakeholders. So it's board members, operators, managers, town officials, the like, to kind of see what, an expanded version of this presentation, understand what the issues are, and then see if the recommendation on capacity, because capacity, in addition to controlling occupancy, is also a health issue. I mean, a lot of these properties that are supporting 12 beds, 15 beds were designed as 4-bedroom houses, maybe with a septic system to match, not necessarily what they're experiencing. So I think on the agenda, the next item is consideration of an ad hoc committee. If you would be interested in taking this further, the idea is to have a motion out of this committee, and then out of the zoning committee to go to the board. The chair for county board policies has the ability to recommend a ad hoc committee to the board for approval. So we would kind of merge those all together and take something to the board. It would be at the May meeting, because zoning meets after the April meeting, to start the process of forming an ad hoc committee and taking the issues out.
I have one question and might be too open. But if it's a residential area, homes, and they're running a commercial, almost like a motel, how do they get away with that without being zoned commercial? Is there a length of time they can do it, or how does that work?
You want me to go?
Go ahead.
Okay.
Well, I have my hand raised.
Well,
No, it's a very good question. And so at the time, when we took this on in 2018 to become an agent of the state, we, at that point, there was already 275 of them, and none of those had gone through the zoning process to get a conditional use and or zone commercial, any of that. And to obviously go back and do all of that would tie up the zoning department for a good period of time. And now that we have 500 and some, it would just be very complicated, very difficult, and very time consuming to go back and go through that process at this point.
You can decide to do that as a county or not, so.
I just don't think it's fair to a
Excuse me?
residential area.
Yeah, let's
Go ahead,
stay
I'm sorry.
organized here.
Yeah.
Was somebody?
Don.
Okay. Don, you were,
Yes. From my understanding is that this is already happening at the Emera View. So there's code violations. We have children that are in rooms that are exceeding, adults and children exceeding the occupancy space of the room. We already know what is going on there with the drugs. The kids that are wandering around McDonald's parking lot, Marketplace, down the highway, then getting put out to Flat Creek. Why would we even want to go on this venture where we have already just fulfilled the trap house that's already there? And I'm going to use it. That's a big city term word coming from Chicago. It's a trap house. Now you want to put a trap house in the middle of downtown Hayward, and you can't control it as it is now. There absolutely, we do not have the programs available to handle this. We just had Joe talking about young girl suicide suicidal, Native American young girls. We don't have the programs for that, but now let's change AmeriView, which they're already doing with everybody's knowledge, but no one's saying anything. Maybe the city needs to step in. The city of Hayward needs to step in because this is getting out of control. We have a mental illness problem within Sawyer County and throughout the nation. We just had the incident on Saturday with losing 2 police officers over mental illness. Where does anybody not sit on this board and think that that could have been us? That could have been Sawyer County. Look at the numbers Joe is putting through and what HHS is putting through. It's a matter of time. We cannot keep putting a Band-Aid on things. AmeriView is a hotel. They're in code violation as it is. What about the fire department? It's a occupancy. How are they even zoned for that? How can you even be allowing to have beds put into there at this moment? There should be a social worker and a police officer on staff. How many calls have gone there? 140 for a year?
Dawn, this is Dale. AmeriView is a hotel, motel, whatever you want to call it. That's out of the purview of this discussion here. We're talking about short-term vacation rentals, houses, homes. So I understand your concern and your concerns are valid, but I would like to stick to the subject of the Airbnbs and so forth. Okay,
Can I ask a question?
Yeah.
Man, I'm curious, just short answer. How is this compared to other counties, like say Violeta County? Is this situation similar? Are they dealing with the same thing? And if they are, do they have solutions, viable solutions?
So Vilas County is very similar to Sawyer County as far as how they license and the process of going forward with tourist rooming houses. And so, yes, they have the same concerns. They're seeing the same issues, and it's statewide. And so every county is trying to address this basically differently. We're not necessarily getting the support from DACAP, Department of Ag, Trade and Consumer Protection, or DSPS. So we're left to our own devices to try and address this. And I was at a meeting last week with the Department of Ag, Trade and Consumer Protection where Eric from zoning and myself went to basically present this information because they're looking at doing changes to their code. And they at no point did they address occupancy. And we want to make it clear to them that every county is going through this, and why do we all have to try and create our own way of addressing it? So yeah, we're not alone. But I think with what we propose, we don't know of anybody else that's looking at this way of doing it. So if we go forward, I could see a lot of other counties jumping on board with something like that as well.
Matt, I have a few questions.
Mhm.
Did the state get all 72 counties to take over agents as agents of the counties?
I don't know where the overall number is. I know Washburn County is still not an agent. And there's a few others out there, but most of the state has gone to that agent program.
And I was around in 2016 when we took this on and started this. We're probably better off than we did, because if it's this bad for people to watch over that we know from folks down in your department, trust me, the state would have screwed this up even worse than it is now. But one of the key parts of that discussion in 2016 was that this not become a burden for the taxpayers of Sawyer County, period. This was to be covered by collection of fees from the owners of these properties. And I think that's one place that this ad hoc committee really needs to take a hard look at. And what was that last year? We raised some of the fees a little bit.
Just for the water program, but we haven't raised the licensing fees for a number of years.
Well, if we're going to do this right, we're going to have to hire a bunch more inspectors. And it's gonna have to be annual, as well as when called about a problem, specific violation. And we're gonna have to charge the owner, they're making money hand over fist, the people that own these Airbnbs. They're making all, they're buying another home because they're paying the mortgage with the rentals. Why not buy 3 homes and pay the mortgages? They're making a ton of money. Our prices really have to go up a lot.
Yeah, we just gotta be able to justify that to the state. And so, yeah.
Yeah, we did, well, as you know, we can't make money on it, but we need to be able to cover our expenses, and we can do that with the fees. Yes.
Yeah,
But
and
you are correct in that there are many people that own several rentals, and I was just at a series of 3 today, all owned by the same owner, and that's becoming more and more popular as well. So if they have one and then the neighbor's house goes up for sale, you're usually jumping on board.
And that's only one license when they're, that's the other.
The part, Matt didn't even get into, we did check and ask around like other counties, what they're experiencing, and everybody's kind of in the same position. We did, I guess, DATCAP is looking at rewriting their ordinance,
Yes, correct.
but there is really no movement at the state level to address this issue. I mean, back when I think Sawyer County was in it, there was some talk back then, and the state walked away from any statewide regulations. But the conversations I've been in with other administrator types or economic development is actually not even about occupancy or you know, any issues they create locally. It's about the economics of what's happening in communities where so many of these, like you just said, there's so many people that own multiple of these properties are being bought up for vacation rentals or tourist rooming houses. And it's pushing the prices of real estate up. So if somebody wants to buy a property to live here and work here, it becomes unaffordable with the economics of the community. So that's where I've been in some conversations with people talking about how to address that, but then you start to put your fingers into the market. Nobody really wants to do that. Well, Dawn has her hand up again.
okay, Don, go ahead.
Well, you touched on the subject right there, that what I was going to say. My hand had been up from the prior thing, so, but I didn't want to interrupt and get admonished. So my question here is, we don't have affordable housing in Sawyer County as it is. So we're gonna put Airbnb for people that are probably second-time homeowners here and want to own numerous properties. But I have people here that we can't get housing. I can't even afford housing. So we are outpricing the people that live and work here to bring Airbnbs in. We have more, if one of those people gets sick or has a mental issue and they're residing part-time in Sawyer County, Paul, Joe, does that become Sawyer County's issue?
Yes.
This is where I'm going with this, gentleman. We keep taking on more, and ladies, sorry. We keep on taking more and more, and we don't have the programs for the individuals that live, work here, and have children in the school districts that don't have high fiber optics, that are just getting them now. We finally got the terminal built up for the next to the post office and Patty's, but let's bring Airbnbs into Hayward. We don't, our co-op might close, and we don't have food or transportation here. This is where I'm coming from. If I have to run for a county board supervisor again to try to figure out what the hell we're going to do for our residents, I don't know at this point. I understand what you gentlemen are trying to do, but we have bigger issues on the plate here.
Okay, thank you.
Do they have a cap on how many people can?
No, so the state passed a law a few years ago, the right to rent law. I forget what the code is exactly, or the bill, I'm sorry. And it basically, we can't restrict people from the opportunity of renting their property. We can restrict, however, the number of days they rent. Like, so say that facility can only do week-long rentals, and we can limit the number of days in a year. I don't know how many counties have gone that route. I know a few have and put some limits on that way, but we cannot restrict somebody for the right of renting their property.
Can we restrict density in a given area?
I don't think so, because then you're restricting a particular home.
The licensing issue, if a person, an individual owns 3, 4, 5, 6 houses, do they buy a license for each individual home?
If right now, the way it's set up, and this is how the state has advised us to license them. If, say, a homeowner owns home A, and then a year later, home B right next door comes up for sale, and then maybe 3 years later, the other one on the opposite side comes up for sale, they now own all three. They can put up to 4 units on one license, as long as those homes are adjacent to each other. And so that's what we've been operating under. I did make that suggestion or statement to DACAP last week, as far as a change that we would like to see, that each unit should be licensed separately.
That seems like a no-brainer to me, because if a license for one house costs $10, the license for 2 houses is $20, the license for 3 houses, it's gotta go up incrementally.
Right. And so, yeah, we've had this discussion, and yeah,
There might be a way around.
so we're hoping that we can,
But that-
I don't know if we can make that change ourselves, or if that is something that we can't do because of the state code, but it'd be something worth looking into. I just maybe don't necessarily have all the information on how we could do that.
Okay, what do you want from this board about your ad hoc committee? You want us to just say we support the idea, or?
Andy, how?
Yeah, I think a
do you want
motion from
that?
this committee to the county board recommending a formation of an ad hoc committee to address to investigate and address the tourist rooming house issues.
We,
How do you think zoning's gonna, are they gonna be on board with that?
they're gonna have to get involved.
Yeah,
I mean, the zoning committee,
Mhm.
I do not.
because I know in the past, ad hoc committees were kind of frowned on, and they thought they could. For one of the standing committees we already have, so I know zoning's taking a hard stance on this,
Yeah,
they're just starting to look at it.
the idea of an ad hoc committee is being brought forward because that way it's a way to involve stakeholders from the community.
Oh, I see.
So it's not just a committee of the board of the committee members, it's, you can bring in somebody from the realtors, somebody that operates a rooming house, somebody that manages them. So you're getting all those perspectives up front and hopefully building in everybody's concerns and solutions.
Zoning will have a strong voice, of course, but we want it to be.
And their zoning will probably welcome Julia and Matt. Their input.
Yep.
We've been, working closely with Jay already.
Okay, would somebody like to make a motion that we proceed to the county board?
I'll make a
Consider,
motion that we, make plans to have an ad hoc committee to work in tandem with the zoning or whatever, follow their lead. And, maybe just put in information, results, opinion, surveys. I don't know how they want the information brought forward, but these things have to be addressed. But zoning would absolutely be the lead person. Or lead agency, I guess.
and do you, somebody have a proper?
I just
verbiage
don't think
put
we have
in?
enough manpower to do all this stuff.
We've been adding to our team. There are 3 of us now.
Okay.
And we're busy, that's for sure. We're managing right now. I think we're doing okay. But as this keeps growing though, and as we are looking to put more time into addressing more and more issues, yeah, it's gonna take up more time. We need more.
I can read the motion.
Pardon?
Show the summation of the motion.
Oh, please.
Motion to request the county board to establish an ad hoc committee, including zoning members and other stakeholders to investigate this issue was made by Ms. Pearson, second by.
Are you okay with that motion?
Yes.
Second by, wait a second. I'll second it.
Well, is that to help keep a closer eye on what's happening across the board? Make sure things are done successfully and for the ad hoc committee, is that
To make the recommendation, like if we have to have an ordinance, we would like to have stakeholders all bring the voice forward to determine, is this where we want to go or not go as a council?
Yeah, anything the ad hoc committee does has to come back to the board.
So
Okay,
the ad hoc
bring
committee might
information
say,
forward.
don't do anything. But, and if you, and really be bringing it here, right, to say, if you guys say we don't have an appetite for it, we don't want to continue this.
In discussion on what committee would be the committee of jurisdiction, this one or zoning?
You would decide, I think. I mean, I don't have a recommendation tonight. I think we can work with you when we take it to the board to make that determination.
we want the whole board to get on board with
Yeah.
this. Any further discussion?
I just want to make a comment. It is, we do have a shortage of homes and people homeless. And this kind of venture is going on, you see that need out there. And it's been hard.
I know of one individual last
Excuse
fall
me.
who bought 6 homes
Excuse me,
in the city of Hayward.
excuse me, for any discussion on the motion? Okay, then everybody in favor, say aye. Aye.
Aye.
Opposed?
Aye.
Okay, motion passed to present this to the county board and see what they think about it. Okay, moving on to,
Thank you.
thank you for coming. Thank you
Yeah.
for,
Thank you.
16A fiscal.
okay, fiscal.
It's just the monthly reports. We're only 2 months into the year, so it's not even trend setting yet. You're gonna see when you get your March report, we've got our first state hospitalization bills, but those are certainly less, but you're seeing a residential higher.
Sorry, then what?
The state hospitalization, we're paying less there, but your residential. So we took some people out of the state hospital, but we're paying for residential, so it's still, we're still paying it, it's just in a different line item.
Okay. Future,
Patty, are we closing 22 books now about where you expected, or we're still waiting for the bill to come in?
We're still waiting for revenue. We're not waiting for any more bills. Bills are done. Bills are cut off at the end. We have to have all of our reporting of all expenses in by the 5th of February. So by the 26th of January, we cut off all our bills. But we do wait until April 15th, and we got a check in today. We're still waiting for revenue, but we are coming in under budget.
And is that something new with now that Medicaid is not covering treatment facilities? I thought before we used to be able to bill some insurance. When one of our clients was put in Mendota or
Some
Winnebago or,
Yeah, insurance.
but not
Not
Medicaid.
Medicaid, right, for state hospitals, no, yeah,
we used to bill some personal insurance.
Yeah.
health
yeah,
insurance.
personal insurance you can still do,
Yeah.
but, anytime that you're incarcerated or in a mental.
Yeah.
Or in a state hospital. That's Medicaid. Goes away and it comes on.
Yeah.
Ray, did you say what, something?
No,
Oh, okay.
Are we at the end of the agenda?
Yes,
I just wanted to use this an opportunity to make, I guess, an announcement. So with Paul's moving on, we won't call that a retirement, but appreciate that he did give us plenty of lead time so that we could have a seamless transition to a new director. So we did post the position, take applications. We conducted interviews last week. And the recommendation going to the county board for approval at next week's meeting is to name Julia Lyons as the next Human Services Director.
Right.
No more business, we're adjourned.